Keto and improving chronic health conditions. Students, in this lecture, I will discuss about how being on a ketogenic diet can help in improving 7 common medical conditions around the world. I have provided links to all the studies done on the respective chronic ailments, which you can easily find in the Keto Course Master Manual. I hope you have already downloaded it. If not, please do so. It's a complete book with all the links and everything included in that. So let's start with the first medical condition and find evidence how a ketogenic diet can help improve it. Keto and epilepsy. The journey of keto started in 1921 with Dr. Russell Wilder at the Mayo Clinic. Dr. Wilder created a low-carbohydrate diet for children suffering from epilepsy, and it worked. Approximately half of the children have at least half their seizures reduced, including 50% who are seizure-free. Number 2, keto and type 2 diabetes. When a person has type 2 diabetes, he suffers from insulin resistance. A primary feature of insulin resistance is an impaired ability of muscle cells to take up circulating glucose. So a person with insulin resistance will divert a greater proportion of dietary carbohydrates to the liver, where much of it is converted to fat as opposed to being oxidized for energy in the skeletal muscle. In a 2005 study published in the Nutrition and Metabolism concluded that a low-carbohydrate ketogenic diet may be effective for improving glycemia and reducing medications in patients with type 2 diabetes. It was a 16-week study. In yet another study in the same journal in 2008, which was a follow-up done on obese patients with type 2 diabetes who initially pursued a low-carb diet. Now, these people were followed up for 44 months and the results were amazing. The average weight was 93 kilos. This reduced from the baseline, which was at 100 kilos at the start of the initial study. Now, this is great because it's common knowledge that 95% of dieters who try to lose weight gain back more than they had originally lost within a year. In fact, on PubMed, there are over 100 studies that suggest that being on a low-carb ketogenic diet can optimize one's insulin levels and stabilize blood glucose levels. No doubt by improving these biomarkers, a person suffering from type 2 diabetes can lower their medication and experience better health. I've also provided a link to PubMed resource with 56 studies including ketogenic diet and type 2 diabetes. Third, keto and cancer. Keto can help cancer patients. Studies have indicated that unlike healthy tissues, cancer cells are unable to effectively use ketone bodies for energy. This study, published in the International Journal of Cancer, stated that ketone supplementation decreased tumor cell viability and prolongs survival of mice with metastatic cancer. Check out the image. Although according to this systematic review, which is a collection of 11 high-quality studies, that evidence on the effect of diets on tumor effects currently lacking in oncology patients, and more controlled trials are needed to fully evaluate this intervention. Number 4, keto and cholesterol levels. In the additional resource module titled Extra Reading just before your final exam, please do listen to all the lectures. They're super informative and can be very useful. One of the lectures is on cholesterol. Now, there are many myths around cholesterol, and I urge you to watch that video. It busts the myth around cholesterol on why instead of looking at your total cholesterol, you should instead look at two ratios that are much better indicator of one's health. This study shows that plasma LDL cholesterol and triglycerides were significantly reduced by 8.9 and 38.6% respectively for men on a 12-week carbohydrate restricted diet. Number 5, keto and blood pressure. High blood pressure increases risk of heart disease, and excessive consumption of carbohydrates, especially the refined ones, can cause one's blood pressure to rise. Furthermore, these randomized controlled trials and systematic reviews showed that carb restriction does have a favorable effect on one's blood pressure. Number 6, keto and triglycerides. Triglycerides are a type of fat found in the blood. And studies are conclusive on the fact that high levels of triglycerides are linked with heart disease, heart attacks, and stroke. And consumption of refined carbs, including fructose, are shown to increase triglycerides. And therefore, a low carb and or a ketogenic diet is a great tool against high triglyceride levels. And naturally, if a keto diet can normalize blood pressure, increase HDL, lower LDL levels, and reduce triglyceride levels, all this can drastically lower the risk of having heart disease, including heart attacks and strokes. Lastly, Keto and Parkinson. Now, one recently published clinic study tested the effects of the ketogenic diet symptoms of Parkinson's disease. In this uncontrolled study, Parkinson's disease patient experienced a mean of 43% reduction in Unified Parkinson's Disease Rating Scale scores after a 28-day exposure to the ketogenic diet. All participating patients reported moderate to a very good improvement in symptoms. Mind-boggling, isn't it? Now, studies are one thing, guys, and actually getting on a keto diet and getting results is another. It is not easy for most people who have been addicted to carbs and have been eating more than 50% of the calories from carbs, mostly processed and refined, to reduce the calories to less than 5% just one fine day, and then most importantly, sustain it. Carbs are addictive and one may experience certain withdrawal symptoms and even a keto flu and some side effects. So let's discuss this in the next module. But before that, let's find out how a ketogenic diet can affect performance and muscle building.